Good morning, everyone. My name is Neha, and I'm a member of the class of 2025, and I'm currently in Northern England doing my Global Perspective Summer on maternal and infant healthcare and healthcare models here in Northern England and Scotland. So I'm going to be taking you with me on my day-to-day, and I'm really excited to share with you everything that I get up to. Hey everyone, so I'm now at my place of work, and I'll show you. So this is the Durham Infancy and Sleep Centre, and it's where I am currently a visiting research fellow for the summer. So I'll go ahead and take you inside and give you a tour and tell you a little bit about my roles here. So one of the topics that this lab focuses on is sudden infant death syndrome and sudden unexplained death in infancy. And what we look at specifically is how sleeping patterns and sleeping habits contribute to the likelihood of SIDS, or sudden infant death syndrome. And so in this room, we have an observation room where parents and their babies will come and sleep here under observation for our research, and things like video monitoring and vital monitoring and oxygen monitoring are all parts of what we look at. So before I go ahead and start my work and my meetings for the day, I wanted to talk a little bit about what I'm actually doing here. And I wear two main hats here. One is my independent exploratory research project, and the other is the research that I'm doing formally through this lab. And so first, through the lab, the project I'm currently working on is to better understand the living situation in temporary housing for asylum seekers and refugees in Glasgow, Scotland. And so it's a community-based participatory project where we have members of that community taking pictures and doing interviews and explaining to us what that situation is like for them, so that we can present it to the Scottish Housing Council and, have an accurate picture of the struggles for infant safety and maternal health in temporary housing in Scotland. And then I'm personally very interested in the continuity-based model of midwifery and home health visiting here in the UK. So I'm interested in how that contributes to targeting populations that are vulnerable and more at risk for a lot of different health issues by taking away that responsibility of seeking out care and really allowing them to receive care in a more accessible way through things like home visits and personalized midwives who you see continuously throughout your care. So I've been doing a lot of interviews with midwives, nurses, health visitors, general practitioners, safeguarding public health officers, like really anyone who I've been able to discuss this model with and learn more about, how it works, especially with populations like people of color, refugees, immigrants, low-income people, and how that is challenging in a public health model and what's good about it. So now I'll shut up and do my work and drop any questions you have. So I'm just about done with my work for the day, and I thought I'd come down to the river and answer some of your questions that you guys left for me. And so I also thought I would just show you a little view from where I'm at right now, because I think it's one of my favorite spots. So there's probably over 5 bridges that go over this river here in the Durham City Centre, and lots of people like to paddleboard or rowboat or do all sorts of things. And then you can also see behind the trees over that way is the cathedral. I wouldn't be able to show you Durham without showing you the cathedral and the castle. It's a bit crowded because this weekend is graduation for the university, but here's a quick view of the cathedral. And then the castle over that way. Glad that this question was asked because there are a lot of different types of public health research, and I'm a big fan of CPVR because I feel like it's the most ethical and accurate type of public health research that can be done, because it really gives agency and voice back to the communities that you're trying to learn about as a researcher. So I chose this model because I think it really speaks to me, and it's actually something that I had experience with during my civic collaboration summer in Baltimore. So I think it's a great model for learning about what communities value and what they struggle with and how to best address them with public health solutions.